Good morning. Ready for the first session? We just put a brief about the book, Overcoming the Challenges of Students with ADHD. If you would like to buy the book, it will be available on the booth outside. We will follow the program today. So the first session will be with Dr. Russell Ramsey, and then 15 minutes, just 15 minutes to grab your coffee and come back. And after I'm done with my session, there will be lunch served, and you will have 1 hour to enjoy the lunch, enjoy your coffee before starting the next session. So I'm going to leave you now with Dr. Russell Ramsey.
All right, good morning. Is everybody as tired as I am? Good. That means we're doing our job, hopefully. So this morning is a way to pick up on everything we learned about yesterday. My job this morning is to review with you some of the non-medication treatments available for ADHD. I don't think anybody here is anti-medication. It can be an important aspect of treatment. For some individuals, it's an essential baseline foundation, but as I've said and others have said, the non-medications, the psychosocial treatments, the education, the empowerment, this is what affects day-to-day life. So we're going to review what are some of the different options that are available, and also I'm going to review, I know yesterday I was mixing up recess and research. Today I will be touching on what is the research either supporting or not supporting some of the things you may have heard about today, or that you will hear about today. But overall, what are the menu of treatment options, many of which we'll talk about? Medications will always come up, but there's also education, parent education, individual education, the children, adolescents, and adults with ADHD, some of the frameworks that we're talking about, those executive function frameworks, understanding, helping individuals see ADHD in day-to-day life, the disorganization, the procrastination, time management. And the younger the child, the more involved parents and teachers will be, because there may be some self-awareness with children, but in terms of setting up the environment, and awareness isn't enough, so they're going to need a lot of support. And as you move on to mid to older adolescents, they're ready to assume more and more responsibility for themselves, but not yet 100%, and then into adulthood. So we'll talk about some of the behavioral strategies specifically for children and younger adolescents, and we'll run through a bunch of different things. One aspect of ADHD that I think has only relatively recently gotten more attention is the effect on social functioning, social skills, getting along with others, friendships. And to date, many of the social skills training programs haven't been that effective. Going back to a theme we had yesterday, it's not necessarily the lack of knowledge, it's the implementation. So I will introduce a program that has been shown to be effective in terms of the relationships, friendships with children with ADHD, that is targeted for schools. Now, there'll be, in many of my slides, there'll be some statistics, studies, but I'll give you the summary of what the research says. But in reviewing the studies, there are guidelines for how rigorous the research is, either supporting the rigorousness of the research that's the treatments were subjected to, so that we can make a determination of what tends to be more helpful, what is more effective, and which are the programs that just don't seem to measure up as well. But one of the consistent findings, medications generally outperform the non-medication treatments, with the stimulant medications being the strongest, non-stimulant second, and then the non-medical treatments, at least in terms of symptom reduction. And that's an important caveat, caution. The symptoms of inattention, hyperactivity, impulsivity that we'll see in the official list. The official list does not include procrastination, disorganization, poor sequencing, all the executive functions. As we said yesterday, those are underrepresented, and that's where those functioning measures, that's where the non-medication treatments help. And that's, for my money, that's what we target. That's what we're trying to help with. And in some ways, and I think medications do this as well, when they're working well, they can improve functioning too, but the pills, you know, the cliche that's used a lot now is the pills don't teach the skills. You know, they don't make you not procrastinate. And another way to think about the different treatments, medications are considered a broadband treatment. You take the medication, it has its therapeutic effects, it hopefully reduces symptoms, and as a result, hopefully it has positive ripple effects for functioning. Some people will say, once I got the right medication, everything else was easier. Almost like getting the correct prescription eyeglasses. Once I didn't have to work so hard to read, I could read a lot. But that's not everybody. In fact, many people, even on effective medications, will need some additional support. Academic, therapy, whatever the case may be. So that's where most of the non-medical treatments are narrowband treatments. We're focusing on functioning. We want to reduce procrastination, be on time, get out the door on time, all those things. There are many, I would consider them not necessarily treatments. Exercise could be considered, based on the research we're finding, an essential part of somebody's wellness plan. You know, a certain number of minutes each day of aerobic exercise, that has important short-term positive effects for attention, dopamine, a lot of the things that we also get out of medications. Things like limiting screen time, setting down the cell phone, as I see all the cell phones up, off the computer, just having more of a range of things, and the thing about technology, as wonderful as it is a huge distraction away from other things. So, and in CBT, we call them escape behaviors. Yes, I should be doing homework, but let me go over here and check these things, because this is more immediate feedback. Remember yesterday I was saying, if you're delivering positive feedback, do it within 7 to 10 seconds of the behavior. Technology does it immediately and repetitively. Getting outdoors. Now, there's been some research on that, and it's unclear what the benefit of being outside is, whether it's the sunlight, and we're designed to, there are receptors in the eyes that connect to the brain. Getting out in the sunlight helps with regulation, just throughout the day, with sleep and whatnot. Diet and health, just good health practices, getting enough sleep, and setting up environmental scaffolding. And environmental engineering, trying to make the environment a little more ADHD friendly. So where you're studying, trying not to have your video games nearby as much as is possible, even though I know they're on our computers, which are with us all the time. But going into some of the formalized treatments. First, now here we are on a second day of an ADHD conference, and this will be the first just handful of slides on medications. And this is unfair. My closest professional colleague is a psychiatrist, and he's very respectful of the behavioral treatments, but I medicate first and ask questions later. So here's a list, and this should be updated because there's been a couple new ones added in the US at least. The range of options. And these are the options that are approved in the US for treatment of children, adolescents, or adults with ADHD. And not on this list, there are some other medications that have been approved for other conditions, say depression or anxiety, that in research have been found to be helpful in some cases of ADHD, such as when there's ADHD and depression. But they're not on the list because they're not specifically approved for ADHD. Probably more detail than you need. As long as a medication is approved in the US, a doctor can prescribe it for something else. It's called off-label use. More information than you probably need. And generally, the stimulants all the ADHD medications are effective, but generally the stimulant medications have the strongest positive effects. But not everything works for everybody, so that's why there's a range of different stimulants and a range of non-stimulant options. So that'll be it for medications. What about the psychosocial treatments? And the psychosocial treatment, the terminology, I think we've done that in the field to differentiate from what's viewed as traditional psychotherapy. So like cognitive behavioral therapy, which I practice, is a form of talk therapy, but for ADHD we refer to it as a psychosocial treatment because it's not the traditional psychotherapy that you would think where you just go in and start talking and the therapist just listens. And I don't even think most good therapists, that's all they do. But across the board, the behavioral treatments are highly effective. Probably more so than we realized with some of the reviews now that we have a couple decades, and this is for children and adolescents. So across many different studies, massive reviews of, like in this case, over 174 studies, we're finding generally positive outcomes. One area to focus on relevant for our group here is the organization skills training. So from here on out, that'll be OST. So looking at both organizational skills training and the behavior therapy, when you train organizational skills, the organizational skills get better. Because think about it. As working with many adults or college students, they will come in and if they're having academic problems, I'll hear things like, I never learned how to learn. I never really learned how to study. And I know I was growing up, I was never trained how to be organized. You know, at some point I started using a planner, but it wasn't like it was introduced at some point. So we're finding more and more, I think this is true of everybody, it can be helpful having that be trained, just like with mindfulness. But for students with ADHD, it is more essential. And one of the other things, with the training in organizational skills in school, you start seeing improvements at home as well, because these carry over. Or if you started at home, it'll probably carry over to school. These are generalizable skills. Looking at, there are more modest improvements in inattention, but that's not what we're targeting. So that's a bonus, that once you're organized, that you know what you have to focus on, even if you have attention problems, you're better able to focus if you can at least hone in on what do I want to be doing now. And not necessarily on academic performance, but again, the goal, if we're considering ADHD a performance problem, we're working on helping the students get engaged in their work, and then afterwards, the academic performance is something different. And even later on, some of the work on adolescents in school, it's more about trying to avoid failure and dropout, and not necessarily improving GPA at the outset. It's being able to engage in work and not view it and respond to it as something toxic. And even teens with ADHD over the years, Medications and behavior therapy provide a similar range of effects on symptoms, driving, and academic impairment. So again, the areas of functioning, and driving is a huge issue. It's a public health matter. There have been several studies that if you have ADHD and you're not on medication, at least on some simulator studies, the performance can be equivalent. Now, these are group studies, so there's a lot of variation among individuals, but it looks very similar to somebody who's driving while intoxicated on alcohol, which is not good. And even the behavior therapy compared with medications in these samples has more positive effects on impairments. So again, it goes back to, I think that's what we're targeting with the psychosocial treatment. And behavior therapy alone or with medications, stimulants, non-stimulants, are more efficacious, more effective than any sort of placebo. So there's not a placebo effect here. Usually the combination of behavior therapy and medications works best. And the stimulants are more effective, but the behavior therapy is still an option, and some students can't take medications. And at least in some of these reviews, there's not been support, and I'll talk about this more later, on some of the cognitive training, the computerized cognitive attention training, or working memory training. And in terms of diet, trying to remove sugars, it really has not shown to be effective. This is not that we shouldn't have healthy diets, but just if you're trying to treat ADHD and reduce those symptoms, it's not going to be an effective treatment. So the organization deficits in children, what are we targeting with these skills? It's, the teachers in here, you all know it. Keeping track of assignments. Do you have your assignment? Yes. Do you know what you're supposed to do?